Nursing aide exam review question. Let's get started. The nurse aide should provide oral hygiene to a client who is unconscious at least every. Is it A, 2 hours? Or B, 4 hours? Could it be C, 6 hours? Or lastly D, 8 hours? The correct answer is A. Here is why. Frequent care prevents drying, crusting, bacterial growth, and aspiration in a vulnerable client. Option B, 4 hours, is too long an interval for an unconscious client. Option C, 6 hours, is incorrect and allows significant oral deterioration. Option D, 8 hours, is incorrect and would neglect the client's oral health needs. Next question. The nurse aide is caring for a client who needs assistance getting out of bed to sit in a wheelchair. Which of the following actions by the nurse aide would make this a safe procedure? Is it A, place the bed in the low position? Or B, place a pillow on the wheelchair seat? Could it be C, lower both footrest pedals? Or lastly D, release the wheel brakes? The correct answer is C. Here is why. Lowered footrests provide a stable platform for the client's feet during transfer. Option A, bed low, is incorrect. It makes standing up more difficult and less safe. Option B, pillow on seat, is incorrect. It creates an unstable sitting surface. Option D, release brakes, is incorrect. Unlocked wheels allow the chair to roll away during transfer, causing a fall. Next question. A visitor enters the room while the nurse aide is changing the client. How should the nurse aide respond? Is it A, can't you knock? Or B, hi, come on in? Could it be C, boy, he was dirty today? Or lastly D, would you please wait in the lobby? The correct answer is D. Here is why. This politely protects client privacy without being confrontational. Option A, can't you knock, is rude and unprofessional. Option B, come on in, violates the client's right to privacy during care. Option C, comment on dirtiness, breaches confidentiality and is disrespectful to the client. Next question. The client looks forward to playing bingo each morning. The nurse aide should. Is it A, tell the client that the nurse aide does not have time to get the client ready for bingo? Or B, plan the client's schedule so client is bathed and dressed in time for bingo? Could it be C, tell the client the nurse aide forgot about bingo, but they will go the next day? Or lastly D, ask the client to bathe and dress self? The correct answer is B. Here is why. Incorporating the client's preferences into care planning demonstrates person-centered care. Option A, no time, is poor time management and dismisses psychosocial needs. Option C, lie about forgetting, destroys trust. Option D, ask to self-care, may be unsafe or impossible for a client who needs assistance. Next question. The nurse aide is caring for a client who is confused and disoriented. The client starts begging to go home. Which of the following would be the best action for the nurse aide to take? Is it A, tell the client, this is your home? Or B, take the client to the activity room? Could it be C, ask the client to tell the nurse aide about her home? Or lastly D, tell the client, we will take you home later? The correct answer is C. Here is why. Validation therapy acknowledges the client's feelings and redirects into a comforting conversation. Option A, contradict, can increase agitation by arguing with the client's reality. Option B, redirect to activity, may work but doesn't address the emotional need directly. Option D, false promise, is dishonest and will break trust when not fulfilled. Next question. The nurse aide is caring for the client who is alert and oriented. The client touches the nurse aide inappropriately. Which of the following actions should the nurse aide take? Is it A, slap the client's hand? Or B, step back and ask the client not to do it again? Could it be C, refuse to care for the client? Or lastly D, Warn the client that the behavior may be punished. The correct answer is B. Here is why. This sets a clear, professional boundary with an alert client responsible for their actions. Option A, slap hand, is assault and never appropriate. Option C, refuse care, is an overreaction to a first offense from an alert client. Option D, warn of punishment, is not therapeutic. The focus should be on professional conduct, not threats. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.